Hey guys, welcome to We Care Wednesday. My name is Megan Branham, pharmacist at Hawthorne Pharmacy, and welcome to the first week of August. So August is actually National Immunization Awareness Month, and most of you guys are aware that you can receive your flu shot or your COVID shot from the pharmacy. But there's lots of other vaccines out there that you can walk into Hawthorne Pharmacy and receive. So I figured it would be a great idea to go over the list of all 12 vaccines that you can actually walk into the pharmacy as long as you're 18 years and older and receive without a prescription from your doctor's office. So the great thing about not having to have a prescription or to be able to walk into the pharmacy to get it is that I've heard from patients in the past that they've gone to their doctor to get a vaccine and have had to pay for the vaccine itself and also for a doctor's office visit. So if you come to the pharmacy, it can actually be a cost savings matter for you as well. So keep that in mind. Okay, so let's jump into the list of vaccines that you can receive from the pharmacy. I'm also going to go over who may be indicated to receive that vaccine. It's obviously not going to be a comprehensive list of everybody that would be indicated for it. You can find the information on the CDC website. This is just what we see most often in the pharmacy world. So like I said, there's going to be 12 vaccines. So number one is going to be the Haemophilus influenza vaccine or H-flu vaccine, which is mainly given in the pediatrician's office to children. But in the pharmacy world, we'll see it indicated for patients undergoing a splenectomy or rising college students that may be living in a dorm, like close in quarters with a lot of people, may be indicated for the vaccine. Numbers 2 and 3 are going to be hepatitis A and hepatitis B. So hepatitis A is actually spread through eating or drinking the virus, and it can cause serious liver disease. So we see it a lot of times given to chronic liver disease patients. Also, we'll see it given to a lot of patients that may be going out of the country to help prevent hepatitis A. And unfortunately, we will see an uprise in the hepatitis vaccine if there's like a hepatitis A outbreak at like a local restaurant. Hepatitis B is spread differently, so it's actually spread through blood and other body fluids. So patients indicated for this vaccine is basically patients that are exposed to needles in their daily life. So the CDC does recommend that diabetics get the hepatitis B vaccine, as well as healthcare workers that are going to be around lots of needles. Anybody that may be in close contact with somebody that has hepatitis B, it's recommended for them to get the vaccine as well. Number 4 is going to be the HPV vaccine or the human papillomavirus, also known as Gardasil. So HPV is a sexually transmitted virus that actually can be prevented through the vaccine. It's recommended for ages 9 all the way up to 45 to receive the vaccine. This is a big one that's been in the news lately because it's actually one of the only vaccines that we have out there that will help prevent cancers. So those types of cancers that it may prevent could be cervical cancer, vaginal cancer, head and neck cancers. And again, like I stated earlier, you can actually receive the Gardasil vaccine from Hawthorne Pharmacies without a prescription from your provider. Number 5 is, of course, the flu vaccine. This is going to be a big vaccine coming up soon. We should be receiving our flu vaccines in the next month or so. And I know flu has kind of been swept up underneath the rug with COVID-19 being all over the news and in our minds. The flu is real. It's still out there. It kills thousands of people a year. So definitely make sure you come see us this fall for your flu vaccine. Number 6 is going to be MMR, or measles, mumps, and rubella. We don't really see this done very often in the adult world, mainly because MMR has actually been eliminated from the United States in the past 20 years because we've been given the MMR to children. But there has been an outbreak of MMR recently. We are starting to see it be given to adults, mainly if there's like an unknown history of them ever receiving the MMR vaccine. You can always get a booster from Hawthorne Pharmacy for your MMR just to be on the safe side. Number 7 is the meningococcal vaccine. Again, it's usually indicated for patients with or undergoing a splenectomy or for patients that are going away to college. Number 8 is the pneumonia or pneumococcal vaccine. So depending on your practitioner, either 1 or 2 doses are recommended for ages 65 and older, and in some cases, ages 19 to 64 may be indicated for certain chronic medical conditions as well. Number 9 is Tdap or tetanus. So tetanus is recommended every 10 years. So it's 1 shot every 10 years. In cases of women, though, it's usually given during every pregnancy because it protects the baby from whooping cough once it gets born. And also we'll see it be given to lots of grandparents and aunts and uncles that intend on being around that baby. So we don't want to spread whooping cough. So we'll see it get done in grandparents as well. Number 10 is the varicella or the chickenpox vaccine. We don't really see this in the pharmacy world as far as vaccines very often. It's mainly given in pediatricians' offices. But what we do see is the zoster vaccine or the shingles vaccine. So shingles is indicated for ages 50 and older. We do this vaccine all the time in the pharmacy world because shingles can be very, very painful. It's a rash that usually first starts spreading around in the mid-trunk region. I've had some patients that have even gotten it all the way down to their eye, which can be very, very serious, and it can last for months. So I definitely recommend anybody ages 50 and older to talk to their pharmacist or their provider about the shingles vaccine. Number 12, lo and behold, is the COVID-19 vaccine. Hawthorne Pharmacy has been proud to be given the COVID vaccine for months now. We still do multiple shots daily, so just call your local pharmacist and get set up with getting your COVID vaccine if you haven't already gotten it. So that is it. Those are the 12 vaccines that you can walk in and receive from Hawthorne Pharmacy, like I said, without a prescription from your provider. So it may be a cost savings opportunity for you to come to the pharmacy instead of going to your doctor and having to pay a doctor's office visit. Please feel free to call any of us at any time. We would love to help protect you against deadly diseases. That's all that I have for you today. Have a great rest of the day.